I feel like it's a great honor to care for these patients and to care for these families. They let us into their room the first time not really knowing what to expect from our team, and then ultimately they let us into their hearts.
When you come in as palliative care, people, I think the first notion is to think of hospice, and they don't think palliation. So I explain to the families that the physicians that they're seeing on the day-to-day, that's the t-shirt that they wear, and that when our team comes in, think of us as the sweater, because we're the ones providing like a warm hug.
Many times, we in medicine, we use a lot of medical terms that families probably don't understand or may not understand. And so our team is able to go in and sit with these families and focus on their questions that they may have, and focus on what concerns they may have, and what does this look like? What does the big picture look like?
And then I tell them, I'm not really here to give you good news. I'm not here to give you bad news. I'm not here to give you news at all. I'm here to support you in whatever is going on and explain to you whatever didn't make sense to you when the medical team came in and gave you the overwhelming amount of information.
We'll stop by and asking them, what do they need for the day? It may just be to sit and talk with them about anything other than illness, or it may be permission to leave the room and get some fresh air, and we stay there with their child if that's necessary, or go with them.
Bianca and Andrew came to the room and stepped into the situation I was going through. It was more comfortable for me to talk to them and ask them, can you find out about something that I didn't understand about this doctor saying? It was like somebody that I can talk more freely about what's going on and what I need for my son in that moment.
Anything that we can do to honor that life, to give something to the parents so that they're not leaving alone, completely alone. Anything we can do is so important. It's so vital. Somebody had told me that Dr. Hannon had a printer. And so I called him up, and within 5 minutes, he was on the phone with me, very excited about this, and we just decided we were going to start doing it.
The collaboration between the palliative care team and the Advanced Projects Laboratory is one of the most important and gratifying collaborations we participate in. Printing the 3D models of parents and their child provides a framework for memories, a place for parents to put their memories, and allows them both a visual and a tactile stimulus to access those memories.
I find out we got our own scanner, and I was like, yes, this is awesome. This is amazing. I want to learn how to scan. I have the rapport with these patients already, so I really wanted to elevate what we were doing. And so we started doing things that were a little more complex.
I love it. I was like, oh my God, this is the best. It was a great idea to put that scarf and put a little bit of color of it. It was so realistic. I love it. I love it.
The reaction has just been so overwhelmingly positive every time that I think it's great that we're able to give them something in those moments.
You get a QR code with all of them, and they can take it to any center and scan it in and get a reprint.
It's incredibly personal, and it's incredibly meaningful.
Your baby might not be here anymore. You always have something tangible, something I can hold on to that was them.
They trust us, and the trust is really our currency, and we build that trust up through time.
I love what we do. I love the fact that we bring peace, that we bring comfort, that we become a second part of their family.
The closeness that we're able to achieve with families is truly unique in medicine.